Bonjour, buenos dias, good morning, good afternoon. As everybody joins in, we're gonna do some housekeeping before we start. I would like to let you know that this webinar is being recorded. And we have an immense diversity in terms of the regional participants. And we would like to inform you that there is a live caption translation in more than 58 languages. So you will have the instructions in the chat of how to turn on the live captions. Please follow what is indicated in the chat. Bienvenue à cet webinaire. Ce webinaire était enregistré et vous avez la possibilité de faire la traduction des sous-titres dans 50 langues. S'il vous plaît, suivez les instructions dans le chat. Welcome everybody to the webinar Skin Disease as a Global Public Health. I'm Catherine Urbais, founder and executive director of the Health Diplomacy Alliance. And I want to welcome you to this webinar. And why we are here because we understand that we have made an achievement on having Côte d'Ivoire, Ivory Coast, presented an agenda item that is going to be considered in the 156th Executive Board of the WHO, meeting that it will take place next year from the 3rd to the 11th of February 2025. But what these events brings, they will bring the perspective of patients who are living, who have a burden living with a skin condition. We're going to be diving into explaining why skin disease has become a global public health challenge, and from scientific and social perspective. And we're going to dive a little bit more into the details of why policies are needed at the global level and why we are aiming for a resolution that calls for a global action plan. Skin disease is a global health priority. Why? Because we need to tackle all skin disease and conditions. And that includes skin disease related with allergy, inflammatory, autoimmune, genetic, vascular, cancers, and rare anti-inflammatory disease. We are calling for investment into dedicated call to expand expertise and to also particularly among primary health care workers, especially in vulnerable population, not only to enable to diagnostic, but also to prevent skin disease and to support those living with the skin disease. We need to support the expansion of these capacities in terms of research and also how to finance and provide innovative diagnostic as well as new treatment, affordable new treatment. We need to prioritize genetic medication, but also how to establish public-private partnership in order to foster that, and also to improve research in healthcare training. But not only that, we also need to support and engage the role of the World Health Organization in trying to support member states in the process, not only on data collection, but also on the policy implementations and guidance. So we're going to have a set of speakers, and I'm quite delighted to introduce our first speakers. J'ai le plaisir de faire l'introduction à la Côte d'Ivoire, pays qui lidère la procédure d'initiation aux demandes de prendre un ordre pour le Conseil exécutif de l'Organisation mondiale de la santé. Le professeur Mamada Kalouga, qui est directeur coordinateur du programme national de lutte contre la ulcère de Burili et des maladies cutanées endémiques ulcératives du ministère de la Santé et de l'Hygiène publique de la Côte d'Ivoire. C'est pour moi faire un plaisir de vous introduire, professeur Kalouga. Professeur Kalouga, vous avez la parole.
Merci à vous. Moi aussi, c'est un grand plaisir pour moi de participer à ce webinaire et vous donner des explications pourquoi nous voulons cette résolution. J'espère que vous m'entendez.
Oui.
OK. Donc, il faut savoir que allô, vous m'entendez?
Oui, maintenant oui, bien sûr.
Il faut savoir que la peau, c'est la porte d'entrée de beaucoup de maladies dans ce monde. C'est une porte d'entrée. Et la peau est la partie visible du corps humain et fait partie intégrante de l'estime de soi d'une personne. Le problème de la peau constitue une préoccupation de santé mentale, de stigmatisation, d'exclusion, la perte de l'estime de soi. Les maladies de la peau sont rencontrées dans les mêmes communautés co-endémiques avec les MTN. Ces communautés ne font pas la différence entre la basidiobolomycose, par exemple, qui est une maladie de la peau, une mycose profonde, et l'ulcère du Biruli. Et ces personnes-là ne comprennent pas aussi la différence entre un pityriasis versicolore et une tache de lèpre. Encore moins, une forme ulcéreuse d'ulcère de Biruli et une fasciite qui survient après un érysipèle. Elles ne comprennent pas et tolèrent difficilement qu'il y ait une ségrégation en termes de prise en charge ou des porteurs de maladies, des MTN cutanés et les porteurs d'autres lésions cutanées. C'est-à-dire, en clair, les malades ne comprennent pas la différence entre les maladies de la peau et les maladies qui sont dites MTN cutanées. Le problème soulève donc une question éthique et d'accès de santé pour tous. Si la question n'est pas traitée rapidement, il y a un risque au plan opérationnel de ne pas pouvoir mobiliser les populations au cours des interventions avancées et donc un risque de laisser échapper des cas de MTN cutanée plus invalidantes et compromettantes. Et cela va être difficile pour qu'on puisse atteindre nos objectifs d'ici de l'horizon 2030. Et il y a beaucoup de maladies cutanées, mais nous n'avons pas la prétention de traiter toutes ces maladies cutanées. Mais nous voulons cibler seulement les plus courantes. Nous proposons donc une liste restreinte des maladies qui peuvent et doivent faire l'attention par la volonté institutionnelle, aussi bien nationale qu'internationale, dont l'orientation est la mise en pratique au niveau opérationnel dans les pays. Les principales maladies que nous voulons cibler sont les maladies infectieuses cutanées. Et au chapitre de ces maladies cutanées infectieuses, on a les infections bactériennes. On peut cibler par exemple l'érysipèle, les staphylococci, les dermites bactériennes nécrosantes et non nécrosantes. Bon, je vais mélanger un peu plus, peut-être pour donner des explications. Et puis au chapitre des affections virales, on a le zona, l'herpès, la varicelle, les condylomes, les verrues. Et j'avoue qu'on a fait des séances de prise en charge des condylomes dans certains villages. Il y a certaines personnes qui ont des condylomes au niveau génital et qui refusent même d'avoir des rapports sexuels et sont marginalisés au sein de leur société. Au chapitre des affections parasitaires, on peut mettre dans les larvae migrans, les miases, bien sûr, il y a la gale qui fait partie des MTN, donc voilà pourquoi je ne cite pas. Mais au chapitre des infections mycosiques, on a la teigne, le pityriasis versicolore, les dermatophysies, la basidiobolomycose, les intertrigaux, parce que les intertrigaux constituent une porte d'entrée de l'érysipèle. Le pityriasis versicolore ressemble à s'y méprendre à la lèpre. Une fois que les patients ou bien la communauté saura qu'on prend en charge le pityriasis versicolore, chaque fois qu'ils auront des tâches, ils viendront nous voir et on pourra mieux faire le diagnostic peut-être de la lèpre ou bien éliminer la lèpre par exemple. Au chapitre des dermatoses inflammatoires, on a le prurigo, ce sont des piqûres d'insectes, on a les prurites, l'acné, l'eczéma, la dermatite atopique, l'albinisme, la zérose cutanée, le lichen blanc. Et bien sûr, et puis on a des ulcères traumatiques qu'on voit dans ces régions. Pour ce qui concerne les ressources requises ou stratégies pour la mise en œuvre de la résolution, nous estimons qu'il peut s'agir de faire une large communication sur la religion auprès des acteurs communautaires, professionnels de la santé et autres. Il s'agira aussi de susciter la volonté politique en prenant des arrêtés qui adressent la question en complément avec les arrêtés qui existent pour les MTN de la peau dans la plupart des pays. faudra faire aussi une large diffusion auprès des partenaires techniques et financiers. Faire un plaidoyer pour obtenir l'adhésion et l'engagement des partenaires techniques et financiers à soutenir la résolution et à s'engager dans sa mise en œuvre. Définir des indicateurs sur ces maladies et les intégrer dans les documents nominatifs, feuilles de route. Proposer un mécanisme de financement en sollicitant l'engagement des partenaires techniques et financiers, mais aussi l'engagement des États à disposer des médicaments à usage dermatologique dans la liste des médicaments essentiels au niveau des centres de santé périphériques. La couverture maladie universelle en vigueur doit être un moyen d'accessibilité facile pour tous à moindre coût. Les pays et les ministères de la Santé doivent s'impliquer à jouer un rôle important, notamment des écoles, des bases des agents de santé, les maladies de la peau les plus répandues. Former les dermatologues et les répartir équitablement à l'échelle nationale dans les hôpitaux régionaux, généraux, afin d'appuyer les acteurs communautaires. Ils doivent également s'engager à utiliser l'approche de la lutte intégrée pour adresser la question au niveau des communautés co-endémiques au MTN, éducation sanitaire, détection des cas et de prise en charge. Concernant le suivi et évaluation de la résolution, cela peut se faire à travers le système de surveillance des principales maladies cutanées grâce à des outils de notification intégrés. Le système de rapportage des données dans les pays des maladies de la peau. Pour aider à avancer dans les pays les moins développés, il faut développer les outils et l'intelligence artificielle comme moyen pour ces pays-là, les moins développés, pour aider à combler le gap diagnostic du personnel de santé au niveau communautaire. Il faudra les soutenir à travers des expertises internationales. Les attentes des pays à ressources limitées de la part de l'OMS pour le renforcement de la capacité des membres, cela peut se traduire comme l'OMS, par exemple, pourra continuer à développer l'application d'intelligence artificielle sur les maladies de la peau et la rendre accessible à la plupart des infirmières, des médecins, pour permettre d'assurer un diagnostic de qualité. Le soutien des partenaires à l'OMS et aux États membres à la mise en œuvre de la résolution peut se traduire par l'inclusion des dermatoses courantes dans les stratégies de lutte contre les maladies tropicales négligées. Les principaux donateurs pour la lutte contre les maladies cutanées pourraient être les principaux bailleurs de fonds intervenant dans le domaine des MTN selon l'approche intégrée, par exemple ANESVAD, Raoul Foloro, ALM, qui le font déjà en Côte d'Ivoire. Mais aussi les laboratoires et les firmes pharmaceutiques pourraient nous aider. Les pays pourraient, sur la base de cette résolution, inclure la prise en charge des maladies cutanées listées dans le projet ciblant les maladies cutanées tropicales négligées. On charge toutes les maladies cutanées de la peau, mais les plus courantes pour éviter la discrimination et élargir notre panier pour recruter le plus de malades atteints de MTN. Sur ce, je vous dis merci.
Merci beaucoup, professeur Kareluga, pour votre présentation et pour présenter le fait que la Côte d'Ivoire a fait cette initiative au sein de la OMS. On est vraiment fiers de la Côte d'Ivoire pour faire cette initiative.
Okay.
To continue our presentation, I would like now to pass to Jennifer Austin, who is CEO of Global Skin, who will give us the global patient perspective. So I'm happy to pass the floor to Jennifer. Jennifer, you have the floor.
Thank you so much, Catherine. This is a very exciting
day for our organization to be here with all of you. And we are excited to be representing all of our 280 plus patient organizations in 70 countries. So as I mentioned, Global Skin is an alliance of over 280 patient organizations in 70 countries. And the objective of our community is to see that patients with skin diseases are healthy and fulfilled. And that's why this work that is happening at the World Health Organization is so imperative and so exciting, because this is not the case for so many people around the world. And as you can imagine, having a skin disease has an enormous impact on people, because skin is the most important organ in our social functioning. It is the first thing that you see when you meet a person, and it's very easy to tell in many cases that that person is ill and that they have a disease. And often these diseases are extremely debilitating. They're very often chronic. There are many comorbidities that are associated with these diseases. So there are many physical impacts, but there's also a huge psychosocial impact, and that stems from the visibility of the skin diseases. There's often misunderstanding and a lot of stigma that goes along with having a skin condition. There are also health system challenges that patients need to navigate, and this can really make living with their disease that much more difficult. Often the treatments that are available to them are unaffordable, or there are, in many cases, because there are over 3,000 skin diseases, there are often no treatments, and certainly there are no cures for so many of these diseases. Accessing care is also a big challenge, which I will speak to a bit more in a moment. Global Skin did some research over the last number of years, and you can see here the different types of impacts that skin diseases have, but you can see how huge the physical as well as the psychosocial impacts are. And that psychosocial impact is often around the fact that there is great stigma around diseases of the skin, but there's also a lot of minimization. And so while people have their lives turned upside down and they cannot hide the fact that they have this disease, people are often told, but it's only your skin, so don't worry about it. It's not as serious as other conditions. And yet what we see is that there are high levels of suicidality, and because of the burden of the psychosocial impact of skin diseases. And we see just such big numbers of people who truly feel stigmatized. And that stigmatization can range from exclusion socially, but it can also span all the way to human rights abuses. And we certainly see that with some of the diseases that people live with around the world. Getting into the system challenges that patients experience, there are really significant challenges in accessing the expert care that patients need to get a diagnosis and then to get the treatment that they need. Because there are over 3,000 skin diseases, it is a complex project to get a diagnosis for a patient. It can be often a very long path. And unfortunately, when people visit a primary care physician, often they don't have the training that they need to be able to do that diagnosis promptly. And you can see here that there's an example in Ireland where there's actually no mandatory training in dermatology for general practitioners. And in waiting for specialist care, we see longer and longer waiting lists for people that need to see a specialist. And yet there are actually declining numbers of dermatologists in the world. And in places like sub-Saharan Africa, most people will never get to see a dermatologist because there simply are so few dermatologists. So it's really important that the primary care level have the training that they need. In terms of treatment, if there is a treatment or if there is a cure, which is not necessarily the case, it's often unaffordable for patients to be able to use that treatment that is prescribed. In one example, in Nigeria, Vaseline, which is certainly not a treatment that we would think of being terribly effective, but yet can be quite essential in protecting the skin. It's often even unaffordable to purchase Vaseline for people in countries like Nigeria. So what you end up with is what you see in this image. This is a map that was done by patient organizations that are part of Global Skin when we were in Africa earlier this year. We asked them to map the experience of patients in seeking care. And you can see how difficult and confusing and long this process can be, and all the while patients are suffering. There are a number of statistics that I wanted to highlight on this slide, but most importantly, I wanted to just show that even in places like the European Union, skin diseases are highly, highly prevalent. So this is something that is coming into the healthcare system very often. And we also see that so many of these diseases are really, really impactful on people's lives. So now what I would like to do is to just let our patients speak for themselves. So we have 2 videos that I would like to share. These are videos that were produced as part of a campaign by the World Skin Health Coalition to help raise awareness about the impact and burden of skin diseases. So this first patient, his name is Noel, and he is from Kenya.
Patients that are in Kenya are suffering. Problem number 1 is affordability. People suffering from this skin problem, they should be protected, they should be protected, and they should be given a room to talk about how they feel. People need to be heard.
And our next patient is Spila, and she's from Slovenia. She's the mother of 2 children with very severe atopic eczema, or also known just simply as atopic dermatitis or eczema.
The other thing are the waiting lines, like regular wait for my youngest dermatologist. We had for 15 months. And then when he was like 4.5, his skin was so damaged that he actually got a fever from that. And then we were actually hospitalized for 12 days. At the end of the day, I think we do more for our children than we do for ourselves, right? And I just wanted them, to have everything, to have a life, to know that they can do anything.
Now also very pleased to welcome another patient to provide live remarks today. Tony Roberts is the co-founder of Deborah South Africa and is a member of Global Skin, and she will be explaining to us what it's like to live with and to support people with a rare skin disease in South Africa. Tony?
So good morning, good afternoon, good evening, everybody. My name is Tony Roberts, and I am based in South Africa. And as Jennifer said, I'll just be sharing a little bit of what it's like to be on the ground supporting patients in my country. I usually like to introduce myself as a person and then what I'm living with. So I'm a psychologist. I co-founded a patient support group in my country. I also work internationally with patients with this disease and have trained with UPATI. And sort of most importantly around this meeting, I was born with epidermolysis bullosa, or EB for short, in 1993. I think it's always helpful to show what living with a rare dermatological condition can look like. And so these are a few pictures that depict what life could be like. But I think for authenticity's sake and for the purpose of this meeting, it's helpful to also show what things look like behind the scenes. EB is a rare skin disease that is characterized by extremely fragile skin that blisters or shears off from minor frictions. For some, it affects every area of their bodies, both internally and externally. The form of EB that I live with is quite severe internally, and something that's come out of my mouth quite often recently is I'm slowly but surely watching my body pack up, one organ at a time. I had the privilege of attending the First World Congress on Rare Skin Diseases in 2022, and Professor Bodema and Malaria had incredible slides of what it's like to live with EB. And they particularly pointed out how all-encompassing it is. Often skin diseases affect just the skin, but EB has been known to be one of the most all-encompassing skin diseases. It affects patients physically, financially, emotionally, and psychosocially. And the image is quite small, but you can see that there's a picture and around it is a whole bunch of writing. And that's to depict what a multidisciplinary team a patient living with EB needs: podiatry, heart, lungs, eyes, ears, feet, absolutely everything is affected by living with this skin disease. So I'll look at one or two different areas, but essentially one of the biggest burdens in my country is the financial burden. Paired with lack of knowledge, infrastructure, and funding, this is the typical lifespan of a baby born with this disease in my country. So there's dressing borrowing, where patients have to have silicone dressings all over their bodies and bandages, and they find whatever way they can to get a hold of these dressings. And whenever that source stops, they have to use inferior dressings or anything that they can get their hands on. And usually those cause harm. There's then wound infections and the baby's health declines. Then death usually occurs between 3 to 6 months. The other burden in my country is healthcare system burden. I always attend our dermatology congresses here in South Africa, and someone said something quite interesting to me about their learning and training in becoming a dermatologist. She said, "Our training never prepared us for this much death." A mum called Susan here, based in South Africa, said private and public just don't have enough knowledge, if any, and it's difficult to explain to a medical professional who is not open-minded. This is a life or death situation. This wonderful mum is named Tuli, and she's had 2 children with EB, and both have passed before the age of 6 months. She said a dermatologist once said to me that she can see my child if she is still alive after 6 months. I understand EB is rare, but treatments exist, and there are patients that are living amazing quality of lives to age 40, 50, 60 in first world countries overseas. There is quality of life to be had. 30 years later, it can't still be life-threatening in developing countries. We need to work harder to close the gaps. Thank you.
Thank you very much. It's always good to, when we are discussing this issue, to see fair hands for those ones who are within this kind of skin conditions, and to understand the reality of what we are aiming and what we are looking for at the global level. I would like now to understand what is the prevalence in terms of global burden of disease. So you can go into most of the details with that. And for that, I had the pleasure to introduce Dr. Claire Fuller. She's a consultant dermatologist, and she's a board member of the International League of Dermatology Society. It's always a pleasure, Dr. Fuller, you have the floor.
Thank you very much indeed. And so, having heard how ubiquitous and important skin disease is from a member state perspective and from those affected, I'm going to move on to discussing the global burden of disease, highlighting how key the provision of services is for addressing skin diseases, for achieving true universal health coverage. Speaking in my role as an executive board member of the International League of Dermatological Societies, whose mission is skin health for the world. Through our 217 members across 104 countries, we represent over 200 dermatology specialists and advocate for better dermatological care worldwide, especially where there is currently absent or poorly provided. The ILDS is a unique umbrella organisation for professional dermatology societies and represents dermatology at the highest level through official relations status with the World Health Organization, championing dermatology and skin health to ensure its inclusion in global health policy. As we've heard, the skin is a vital social organ, providing an interface and impacting our relationships, integration, as well as mental well-being. It's essential for life, providing a key barrier and crucial for relationships and communication. And there are more than 3,000 diagnoses, distinct skin diseases that occur across the life course as well as throughout the globe. There are various groups of disorders classed according to their underlying cause, from inflammatory or immune-mediated through infections, many different skin cancers, and genetic or hereditary conditions. Skin diseases are the leading cause of the global burden of disease, ranking number 5 out of 22 disease categories. 3 skin conditions affect the commonest 10, are in the top 10 of the commonest skin diseases overall, with neglected tropical diseases which frequently have skin manifestations coming in at number 8. So how do we quantify burden? Well, in the scientific literature, it tends to be, we tend to see terms like years lived with disability, disability adjusted life years, and healthy life expectancy. But what we're missing, there is a dearth of formal data about the direct and indirect impacts of skin disease at the personal, social, and economic level, a big global knowledge gap which hampers advocacy and prioritization campaigns. And affected individuals and those who care for them, we have heard and we know firsthand how much skin disease impairs life quality and mental health, and can lead to social isolation and stigmatization, as well as impacting on life productivity, on work, and on income. And at the public health level, there are significant costs to healthcare services. However, in many parts of the world, access to essential care and drugs is limited, particularly in resource-limited nations. So what about the headlines? There are nearly 5 billion new cases of skin disease occurring each year, with the highest recorded deaths, and yes, I do mean deaths, in South Asia. While skin disease occur across the life course, they're commonest amongst babies and young children, and in countries with a low socio-demographic index. And taking a couple of specific examples, psoriasis, a common scaly skin condition affecting approximately 2% of the population worldwide, is not just a skin disease. Data shows that those with psoriasis have a shorter life expectancy than the general population by 6 years. And scabies, a tiny mite that leads to severely itchy skin, is frequently complicated by infections of the kidneys and the heart valves, leading to lifelong impacts on health for those affected. We see here some of these common skin diseases or common conditions of effect shown in a graph form, showing how skin disease and skin signs affecting neglected tropical diseases are really in the top high numbers of the global burden of disease. And here are a few common skin diseases expressed in the proportion of the population that has a condition at any specific point in time or during a period of time. And finally, non-melanoma skin cancer is the most frequent of cancers worldwide, and deaths from skin cancers are increasing, especially in low-income countries. So skin disease is common. Skin health is currently not prioritized, with access to skin health services being poor in many parts of the world. Universal health coverage cannot be achieved without including skin health, and a concerted effort across cross-cutting multiple government and non-governmental agencies, as well as civil society organizations, are required to address this, including non-communicable diseases, climate change and the environment, healthy life course, occupational health, pandemic preparedness, emerging infections, and wound care, to name just a few where the skin health and skin care impacts. Skin health matters to global health, and so I'm delighted to pass back to Catherine to explore the next potential steps.
Thank you very much, Dr. Claire, for that presentation and for your insight about the reality of skin diseases, skin conditions. So in that sense, I would like to go a little bit more on the global aspect of it, and the global and the policy aspect of it. So why we are seeing this kind of engagement, and what we have heard now with the Côte d'Ivoire and patients and also dermatologists trying to bring the attention of this global movement. Why? We have seen that in different scenarios, there has been several achievements in terms of trying to put skin disease at the global discussions. We have seen works, as it was mentioned, in terms of neglected tropical disease that has been done in the spectrum of the work of the WHO, and including a WHO entity roadmap 2021 and 2030. And there is, even for next year, we're going to have scheduled the second global meeting on skin entities. And we had it, the first one, in 2023. If we look also, not only, you will see in the slide, but we don't even have the space to see how many initiatives comes into place in terms of what it has been done at the global and at the multilateral level in terms to incorporate the skin disease, not only within the body of the World Health Organization, as I mentioned, but also in the Human Rights Council, bringing the right perspective, the human right perspective of people living with skin conditions. But why we need to do this approach and why now? We have seen that while we are calling for this resolution, we have seen and we have heard that there is a need to enhance surveillance and to strengthen national responses to skin disease. And that would be, if we look at what is needed, we need to improve national data collection and the mapping of support targeting intervention to skin disease. We have already heard that we need to build that capacity in terms of primary care, not only to prevent, but also to diagnose and manage skin disease and comorbidities. We need to strengthen the laboratory capacity. That's what I mentioned at the beginning of this. And we have to ensure that this diagnosis tackle also antimicrobial resistant. And we are seeing this emerging of new diseases and also climate-related skin conditions. You have mentioned in terms, I mean, you both, Dr. Fuller and Jennifer, have mentioned about the access to care. We need to promote affordable treatment and to ensure the ability of essential affordable medicines. We have, and this is something that has been mentioned, we need to incorporate people affected with skin disease into national disability plans and also to take in consideration mental health policies and plan as well. But I'm listing one by one why we still need that. What are the things that are missing? Even though we have policies in place, even though we have initiative in place, there's a lot of things to be done. And that's why we're aiming and we are supporting member states to advance on these issues. So we have seen that there is the skin entity roadmap, right? But we need to accelerate those efforts to meet the 2030 targets by promoting an integrated and holistic approach. We need to empower patients. We need to strengthen national academies and research institutions to conduct this type of studies addressing country-specific skin disease challenges. It has been mentioned, certain countries have specific skin disease challenges, and it's difficult from the global policy perspective to tackle all identified 3,000, almost 2,000 skin disease and conditions. So in terms of the global work that is happening right now, we need to engage international organizations, NGOs, donors, and other stakeholders to reduce what we see as the medical and the social and economic burden of skin disease globally. We need to reduce stigma, discrimination, and the mental health challenges. We need to promote partnership with the public-private partnership to ensure affordable access to prevention tools. But why we need all that and how we do it? What we have seen here is that a group of countries led by Côte d'Ivoire have presented an agenda item for being evaluated in the 156 Executive Board of the WHO that is going to take place next year. And what we are calling for action, we are calling to develop a resolution that integrate the way we have to be adequately providing and also revising all skin disease. And that is to develop a global action plan that is result-driven, that is oriented global action plans on public health response to skin disease. And the way we better achieve that is in consultations with all stakeholders at all levels, including member states and civil society. And we need to engage the work of the WHO to support member states in strengthening their own national capacity in terms of diagnostic, revision of strategy, and enhancing the workforce training, and including adoptions of new digital tools. But we need to do that, and we have seen it, we need to do it to advocate for with a patient-centered care that is prioritize patient needs and their caregivers, integrate mental health support, and to reduce the stigma to improve quality of life. And we have to have in consideration there are several things that are affecting not only what we have seen right now, but we have seen that increased amount of emergent diseases, environmental factors that are affecting the skin disease, antimicrobial resistance is also there. So, but why we need a global action plan? Why we need a resolution? We need it because we need to create clear objectives and targets. We need to create a timeline of achieving them. We need the role and the responsibility to involve all parties, and we need to find mechanisms to monitor and evaluate those type of mechanisms. We need an action plan to also support WHO and to give the leadership of WHO to be able to support national programs. We need to improve our national policies, and we need to improve those affected that are the patients. Thank you very much. And now I finish my presentation, and I would like to pass to the discussions. So I see that the Q&A, there has been some question posed. And I would encourage anybody who would like to have some questions or want to have some clarifications in terms of what we have discussed, please, or share an experience, please do so right now. Raise your hands, use the chat, the Q&A. I think our presentations have been really clear. Am I correct? I see one question. I'm going to start. I see some hands, but before we start giving the floor, I see that there is questions in terms of facilitation of access to specialization in dermatology. Dr. Fuller has already answered the questions in the Q&As, but this is something that I have been touched upon, and you have touched upon in terms of what we need at the global level and why we need this resolution. I see the hands. I see some hands. So I will give it in the order that I have. I have Henry Lim. If you can briefly introduce yourself and pose the questions, and if it is intended for somebody, please do so. You can unmute yourself.
La question, c'est pour qui? C'est pour moi?
Non, c'est pas encore. Ils n'ont pas posé la question.
Okay.
So Henry Lim, you can introduce this. You can unmute yourself, please.
I can unmute. This is Henry Lim. Can you hear me now?
Yes, now we have Henry Lim. Perfect.
Okay. I'm Henry Lim. I'm the president of ILDS. I would like just no question, but I just want to compliment all of you for organizing such a nice and very, very important conference. Congratulations to all of you. It's a very important cause for all of us, I think, to do this. Thank you very much.
Thank you very much. I see that there are other questions on the line. Dr. Abuga, you can unmute yourself, please, and pose your question.
So am I audible now?
Yes, perfect. Thank you.
All right. Thank you very much. My name is Dr. Obakar Waziri from the African Center of Excellence for Neglected Tropical Diseases and Forensic Biotechnology at Modibello University, Zaria, Nigeria. Yes, thank you very much, the organizers, for this very important workshop. It's quite enlightening. I have a concern, and my concern is centered around Buruli ulcers. You know, currently in Nigeria, we do not have a data surrounding Buruli ulcers, and there's a sister center that is collaborating with us, and the sister center is the National Center for Tuberculosis and Leprosy. So I'm just trying to direct my question to the presenter on the presenter that talked about the possibility for the global skin, the global skin, if it's possible for us to see what we can do together to ensure that we try to do some bit of work, especially in gathering data concerning Buruli ulcers in Nigeria. We know that there are sister countries around us who reported this, but Nigeria, as we speak, do not have any particular data on Buruli ulcers, and publications are very few. My center is trying to look at areas concerning Buruli ulcers, so we are looking for partners that could help us fine-tune this, especially in terms of the field research. Thank you.
Thank you very much. I don't know if you want to comment.
I can respond. We welcome the opportunity to work with civil society in any country, particularly if it's a patient organization, but often in different countries, particularly in low to middle income countries, there are sometimes no patient organizations. So we're open to helping you start up a patient organization to interact with us. We can provide support to that organization. We actually have a guide on how to start a patient organization. Tony's organization actually started as a very young, small organization when they joined Global Skin, and were able to grow, I think, in part because of working with us. We are very interested in data and patient perspective data in particular, and we have been working on a major research project for the last 8 years on the patient perspective. And so if we were to have a patient organization in a country like Nigeria, and we do have several, but just none on Buruli ulcer, we might be able to generate some data about the patient experience of living with those conditions. So we're always open to those types of collaborations, and you can reach out to us. Just go to globalskin.org and you can reach out and we can discuss collaboration. I think that that's the strength of our community, is being able to collaborate across different stakeholder groups.
Thank you very much, Jennifer. I see Seb Oyo. Seb, you have the floor. You can unmute yourself, please. Pose your questions and please introduce briefly yourself.
Good afternoon, everyone. I hope you can see me.
Now we see you.
So, okay. Good afternoon, Catherine and everyone. My name is Sebastian Oiwo. I'm a consultant dermatologist at Irua Specialist Teaching Hospital, globally renowned Center for Infectious Disease. So, thank you so much for this opportunity, this platform to share thoughts. But I think I must also appreciate the government of Nigeria for lending the support. I guess that may have been some form of omission since the beginning of the discussion. I think Nigeria, as well as Cote d'Ivoire, have sent a letter of support for skin health agenda. So I think it's important. I need to appreciate the government of Nigeria, and you can rest being assured that there'll be a lot of support from Nigeria. We do hope that going forward, we'll get a lot more. It's important to state that, of course, Nigeria has the highest body of neglected tropical disease in Africa. And so a lot of work has been done, especially by the national program on NTD control and elimination in addressing some of this. And to also quickly address Dr. Waziri's concern, there's a national tuberculosis, leprosy and Buruli ulcer program in the country that I think would be able to help him answer some of his questions. So I'll be glad to connect with him and see how better to move this across. And to also say that, yes, we have a very fantastic dermatologist in Nigeria under the aegis of the Nigeria Association of Dermatologists. Yes, quite a handful, the proportion of, say, maybe a dermatologist to, say, about 1 million, 2 million patients. But we are doing our best to ensure the best of care, skin care for our patients. So I think going forward, we'll continue to push better to see how things get better. Once again, appreciations to the organizers, to Cote d'Ivoire and to Nigeria for sending in that support, and as well as Togo and I think a fourth country. Thank you.
Thank you very much, Zeb. And this is something that I will bring at the end in my closing remarks about those countries who have joined Cote d'Ivoire to really put this skin disease in the global level and to the attention. So thank you, Nigeria, for the leadership and for the support in this process. We really are working together to support you from the civil society perspective in terms of how to advance and to really keep this momentum. We have 2 more questions. So I have those of you can please unmute yourself, and after those of you, we have Dr. Gonasike. Please, those of you, unmute yourself and pose your questions. We have some other quick Q&As, and we are being answered some in the Q&A as well. So yes, please unmute yourself and pose your question. I don't know if
Bonjour.
Yes. Bonjour. Vous avez la parole.
Bonjour tout le monde. Oui, donc je suis Dr. Nyosike Piham. Je suis le coordonnateur du programme national des maladies tropicales négligées au Togo. Et nous sommes particulièrement fiers au Togo d'avoir soutenu cette initiative. Le ministre de la Santé aurait voulu lui-même être à cette réunion et s'il n'avait pas eu un agenda très chargé. Et donc, le Togo ne déroge pas à cette situation que vous avez présentée, car malgré les efforts du gouvernement, la pauvreté demeure un sujet de préoccupation nationale. Et selon le rapport de 2020 sur le profil de pauvreté, il en ressort que l'indice de pauvreté en milieu rural est 2 fois plus élevé qu'en milieu urbain. Cette pauvreté est également associée à un profil épidémiologique du pays et est un terreau fertile pour les maladies de pauvreté, dont les maladies tropicales négligées. Les maladies en particulier, mais les maladies de peau en général, qui constituent donc un fréquent motif de consultation dans les centres de santé. D'après plusieurs évaluations, dont une que je vais citer, qui a lieu depuis 5 ans au Togo, plus de 2% des patients qui sont dans les centres de santé consultent pour des problèmes de peau, mais nous savons que ce pourcentage est largement sous-évalué. Plusieurs facteurs donc limitent l'accès aux soins dermatologiques, par exemple chez nous. Il y a le manque de ressources, comme vous l'avez signalé. Il y a également les coûts de traitement qui sont très, très élevés pour certaines maladies. Nous avons également des difficultés d'accès géographique, surtout, comme on l'a dit, les populations rurales et les communautés isolées, qui sont le plus touchées par les maladies de peau, mais qui, en raison de l'éloignement avec les centres de santé, n'arrivent pas à avoir bénéficié de ces consultations. Et il y a une étude au Togo qui l'a montré, puisque en milieu rural, les prévalents des dermatoses doublent celui des milieux urbains. La stigmatisation, vous en avez parlé, et surtout le manque de dermatologues. La majorité des dermatologues sont en milieu urbain et surtout dans la capitale. Et donc, il y a beaucoup de choses à faire. Et donc, cette approche globale de la lutte contre les maladies de peau a beaucoup d'avantages. Et c'est pour cela que le Togo en partenariat avec la Côte d'Ivoire et le Nigeria, appuie l'initiative et appelle instamment les États membres de l'OMS à soutenir résolument cette initiative. Donc, en demandant à l'OMS de développer un plan d'action mondial pour toutes les maladies de la peau, nous posons les bases d'une réponse coordonnée et efficace à ce défi de santé publique majeur. Ensemble, nous pouvons donc améliorer considérablement la qualité de vie de millions de personnes et contribuer à atteindre les objectifs de développement durable. Et voilà ce que je voulais ajouter. Merci beaucoup.
Merci beaucoup et merci aussi pour le Togo pour cette initiative et pour soutenir. On est vraiment fiers de votre soutien pour cette initiative avec le Nigeria et le Côte d'Ivoire. On vous remercie beaucoup pour cet appui. We are running almost out of time, and I see a lot of hands. I will pass really fast before we give our concluding remarks, because we have some measures to give to you on what you should be doing now, because there is a process of negotiation that is happening between member states with the governments in Geneva and virtually. They are going to be consulting about the possibility of this resolution, and they will do so on the 16th and the 20th of December. I will give really fast the floor to Guadalupe. If you can say something really brief, so I can give you the opportunity to speak. I have tried with David, but I don't think Guadalupe, if you wanna unmute yourself and say something in 30 seconds, as we're running out of time. I think this webinar has really put it clear, and having the Togo, Cote d'Ivoire, and Nigeria, and also Micronesia, who supported the inclusion of the agenda item. But what we do now, I mean, there's a lot of unanswered questions, and what we need as a next step is that you, from civil society, from your government perspective, that you should be a catalyst to bring uplift what is happening with those people with the burden of skin disease and conditions, and that this is reflected in a resolution, in a WHO resolution. This resolution is going to be considered during the executive board. So be a voice of change. And I would like you to take the message and encourage your members, your governments, to support Cote d'Ivoire, Nigeria, Togo, Micronesia, who are the member states who are leading this process, and other member states to a virtual consultation, as I mentioned, that is going to happen on the 16th and the 20th of December. And we need you to urge your government not only to be participating in these negotiations for this resolution, but to secure support and also to allocate funding and to support the WHO for establishing of a global action plan on skin disease. Please keep in touch and continue following all of our social media that you have received in our chat. And if you have any question how you address your government or how you get involved into this process, please contact any of us, any of our organizations. We are a coalition of civil society. Feel free to do so, and we will be guiding you throughout the process. Thank you very much. It has been a pleasure. And bear in mind that this is the first but not the last of webinars that we're going to have during all this process. Thank you very much for your participation, and thank you to all the speakers. Thank you.
Merci à tous. Merci à tous. Bye.